Hello, everyone. We are really excited to be talking today to Tamara van Zyl. Tamara, you graduated in 2000 at the University of Pretoria. You've worked in a variety of settings, and today we're really interested to talk to you. You've got a whole range of clinical expertise in audiology, but there's one particular thing I think we're also going to talk a bit about, and that's your interest in cochlear implants and working in that field as well. You've got a dedication to patient-centered care. So we're really excited to talk to you. Welcome to our APPF podcast. Really excited to talk to you. Yeah, maybe begin by telling us a bit more about the clinical work that you do, specifically looking at cochlear implants as well.
Good morning, Cybrand. I'm really excited to join this morning. Yes, I'm a very passionate audiologist, and I always say to my patients, I'm one of those annoying people that can truly say, I love what I do. I wake up every morning and I'm excited to see patients and to see the changes that I can make in their lives. Cochlear implants are very dear to my heart because many of these patients come to my doorstep and they feel a bit anxious, worried, depressed, and almost at a place in their life where they feel there's no solution left to give them access to good hearing. And I always say it's really amazing to see how patients present. Many times adult patients will come for evaluation, and during the first evaluation, I can notice that they are depressed. They've got bad eye contact. They're unwilling to communicate with me. They sometimes bring a partner with, and they will heavily rely on the partner to do the communication on their behalf. And then going through this whole journey with them, starting with that person, and that person then getting a cochlear implant and seeing them 3 months after they switch on, it's like a different person. It's amazing to see what good hearing does to all aspects of your life. And I think that's why I love the job that we do so much, is the fact that, yes, we address people's hearing concerns, but in the bigger picture, we look at their whole well-being and their quality of life. And it has such a massive impact on everything. So yeah, I'm fortunate. I always tell my patients, I really feel fortunate and blessed to be able to work with patients with cochlear implants and to just be the person holding their hand through this whole journey and seeing how they blossom from a person that's shy and really not interested in any communication to someone that is open and communicating. And yeah, it's wonderful. And then obviously with the babies, I always say we start out with a big box of tissues and we also end with a celebration. I always ask or tell my patients, if it's a young baby, I always say, remember your child now has a birthday, the day that they were born, but they also have a hearing birthday. And that should also be celebrated. And it's always lovely to see they have 2 birthdays. So my cochlear implant kids feel happy because they've got 2 birthdays to celebrate. But yeah, these children, to see how they go to mainstream schools. I've got many children here in our local community that are in mainstream schools and they are absolutely thriving. So a cochlear implant is a modern day miracle.
I am right in saying that, that is one of your passions as well in clinical work, right? So we can talk about the other things as well, but cochlear implants is one of the big things that you also do. Yeah, tell us a bit about the technology, as the way that the technology has developed and nowadays how modern these devices are.
So Cybrand, yeah, that's also amazing to see where we started and where we are today. The first cochlear implant devices were body-worn devices, and the children actually used to have like a little backpack on their back, a big lumpy device that they had to wear around. It was very easy for the maps. That's what allows the patient to hear. We refer to that as a map. It was very easy for the map to be wiped off. So these children couldn't, static electricity was the enemy. So they couldn't go down a slide. They couldn't take off something over their head because the static would wipe the maps. It sounds almost impossible, but that's where we started. And they still had access to good hearing, but the devices were really old-fashioned and lumpy. These days, we've got 2 options to give to patients in terms of the externals. We can either fit them with something that's completely off the ear, that's just a head-worn device, or a traditional style BTE device with a magnet that connects to the implant. So it's important to realize that a cochlear implant has two parts to it. You have the cochlear implant that the ENT surgeon implants during surgery. And then you also have the external part that is connected then with a magnet to the internal part. And that's actually the part that picks up the sound and takes it through the skin to the internal portion of the cochlear implant, where the electrodes are inside the cochlea, and they take over the work of the hair cells and allow the patient then access to sound. These days, you can connect to your iPhone, you've got direct streaming, you've got an app on your phone, you can FaceTime, you can Zoom, you can do all those things with direct connectivity. So our cochlear implants patients have all the same benefits that our hearing aid patients benefit from these days. And the sound quality is also very good. And the external part is where we see technology improving, but also the internal part. But just to give you an example, I've got a patient here in our community that was implanted in the early 80s. And he still uses those implants that were implanted in the early 80s. And the external part is the part that's being upgraded and gives him access to all the latest features. So they are made to last. That's the wonderful thing. And they give access to patients between the range of 0 to 20 dB. And as you know, that's the normal range of hearing. So it's extraordinary to think that a patient that is completely deaf, has really bad hearing, we are able with a cochlear implant to restore the hearing thresholds within the normal range again.
From one cochlear implant audiologist to another, we haven't very regularly had an opportunity to have a nice chat, Tamara, you and I. I wanted to show you something. I have a patient that was one of the first implantees to be implanted with the House, the 3M implant. And it was explanted because it caused so many infections, but here's the implant. And you were talking about a body-worn device, and I just want to show you, he dropped off his body-worn device. So this was the battery pack that takes one AA battery, and then it would be body-worn and have this was the long cable, and that's the coil. Incredible how this has changed. And I know that you did some work for one company where you worked a lot with their implants, but knowing now that there's available 3 major manufacturers of cochlear implants in the world, tell me a little bit about how that transition happened for you, and whether you still stick with one company, or have you enjoyed some of the features of other companies, and what you tend to deal with and work with.
Cara, you're correct in saying that I used to work for a cochlear implant manufacturer. And that was actually a wonderful time to learn, because it's amazing if you are involved on a clinical level to then be serving the whole country. The amount of difficult cases you are seeing, your learning is just accelerated. So I really benefited from working for them. But now, being in private practice, I'm all for choice. It's actually very important for me to offer patients choice, whether it's with hearing aids or bone conduction devices or cochlear implants. Yes, I give choice. And at this stage, I supply Medel and cochlear implants. And yes, there are definitely specific reasons why we would recommend a certain implant. But once again, I would guide my patients. If there's not a specific clinical reason for going for one or the other, I will spend time with my patient to explain the difference between the two companies. And especially in adults, it will be their choice to say what they prefer, if there's no clinical reason for a specific implant.
That's awesome. Well, that's what makes you an independent audiologist, right? So not just with hearing aids, that you're able to give your patients the full spectrum of treatment devices based on their hearing loss. So whether it's a hearing aid or a cochlear implant or an implantable middle ear device or an external soft band Baha, or any of those options for all the range of hearing impairments that you probably see a lot of in your practice, that you're able to offer them full choice. How was the transition for you moving from corporate audiologist to independent private practitioner?
You know what? I always said I will go back to clinical work, because at the end of the day, my heartbeat is for patients. And the biggest reason why I left the corporate aspect of our work is because I missed patients. I missed having that personal interaction, sitting with a patient, problem solving, deciding what will work best, looking at my toolbox and looking what all our choices are and making the best decision for that specific patient. Corporate audiology definitely taught me a lot about business. And I definitely think sometimes working in private practice, that's the one thing that we don't get a lot of exposure to. So I learned so much from my days as a corporate audiologist, and I will never wish that it wasn't so, but I'm definitely so happy to be back on the clinical side of things. That's what makes our work so special. You know, I always joke and say, because as you heard, I qualified in 2000. So I've been around this block a few times, and it's amazing to see how, I mean, there are babies that I were involved with their implant. And they are strapping, handsome young men now at university. And that's also what's so special about our work, is you really build a relationship with your patient. It's not a once-off where you go for a knee replacement or for a heart transplant, or whatever the case may be. We've got such intimate, close contact with our patients. And we know the little details of their lives, their family, the things they love. We really have such special relationships with our patients, and that also makes our work so different from any other job. And I think that's where our job satisfaction comes from. It's the fact that we've got these very special personal interactions every day.
Tamara, I can imagine this is probably for you as well, Cara, that working with cochlear implants, I can imagine it's very rewarding, even though the effect of traditional hearing aid fitting can be just as impactful for a person. But I can imagine there's also a sense of relief, because you've got a little bit less of that corporate competitive, situation where you might get with hearing aids nowadays, traditional hearing aids. And because it's such a specialized field, looking at the changing audiology landscape with traditional hearing aids and over-the-counter hearing aids and so forth, it must be such a relief that you're offering a very specialized service.
I think it's very important for all independent audiologists to start investigating these specialized fields within the field of audiology, because I definitely think that is what sets us apart. I always say, with all the big chains opening up and all the over-the-counter offerings that we get these days and all the competition within the market, I really can't be bothered. And the biggest reason for that is the fact that that's not my focus. Yes, it's a means to an end, even if we talk about a traditional hearing aid, or whether we talk about a bone conductor or even a cochlear implant. That's not why you came to see me. You came to see me for my expertise. And I do realize there are lots of competition in the market if we think about hearing aids. But once again, I feel if you have good clinical service, a positive personal experience for your patient, that's what makes the difference. And yes, with cochlear implants, we are privileged that we are only a few clinics in the country working with it. But then I want to add, Sabrand, yes, that is nice, but it's also stressful. I always say my cochlear implant kids are the ones that keep me up at night, because they need to be able to have access to good hearing, to be able to develop normal speech and language. So they need to be monitored. It's a very involved process if you work with cochlear implant patients, and especially so with the children. We follow them up every 6 months. We map them. We do aided testing and speech perception testing, because we want to be sure that they truly have access to normal levels of sound to be able to develop speech and language. I always say cochlear implant work is my best work, but it's definitely my hardest work as well in the practice.
Couldn't agree with you more. I find that it's very stressful. And for me, I was involved. I've always been in an independent practice, and I haven't worked in corporate. So it would start with me diagnosing. If we're talking about a child, it would be the diagnosis, which is bad news. It would be the hearing aid fitting and trial, which is often unsuccessful. Then through the whole process of cochlear implantation, and then the rehab afterwards, and continued rehab and continued mapping. It almost felt for me at one point that I was a one-stop shop, and it was very, very stressful, because it's great when everything goes well, but it's an absolute disaster if the wheels are falling off, and then you almost get blamed for not reaching expectations. So do you also do rehab as well as the diagnosis and all the various intervention options, and then rehab afterwards, or do you refer out for rehab?
My background, as you know, I worked at the University of Pretoria's Cochlear Implant Unit for quite a few years, and in that setup I was involved from beginning to end. But in private practice, you know that our equipment is really expensive. So unfortunately, at this stage, I don't have diagnostic pediatric like ABR equipment to do the diagnosis. So I refer to one of my colleagues. Actually, I have two colleagues that do that. So once a child is identified, I've got a newborn hearing screening program at my hospital. But once a child is then identified or has failed 2 screens, they then go on for a diagnostic test, and the diagnosis is made there. But then from there, I take over again, and I do hearing aid fitting and trial if necessary, and then on to cochlear implantation. And with the littlies, I don't do my own rehab. With adults, I do. The littlies go to the Karel de Toy Center, where they get access to auditory verbal therapy. And I know you also involved with that. So no, I'm in certain aspects involved, but not so heavily on the rehab side. I only do the adult rehab. But once again, I want to go back to that point of us looking at our skills and what's the offerings that we are giving to the public. And rehab is such an important part of the whole process of getting any hearing intervention, whether it's an implant, a hearing aid, a bone conductor device, whatever it may be. I always explain to patients that my emphasis is on the day that they receive their technology, whatever the technology may be. My job don't end the day that they receive it, it starts. Because from that day onwards, I need to objectively and subjectively measure and be sure that they've got good hearing and access to everything that they need. I think for a lot of retail sort of orientated hearing aid shops, it's all about selling the hearing aid. It's a business and it's retail. And their focus is on, that's their end point. They want to get hearing aids in ears. But that's actually where our job is supposed to start. And as an independent audiologist, that should be our focus. Because from there, we should do a verification, we should do questionnaires, we should be sure that we've given to our patients is actually doing what we promised them that it would do. And if we don't meet those expectations, to counsel them for the reasons why it's not happening. Because we don't only have happy stories in our practices, unfortunately. I mean, it's very rare, but we even have cochlear implant patients that don't have good outcomes. But if we go through this whole journey and we do all the subjective and objective things as we go along, it makes it much easier for a patient to understand why they are not reaching the goals that we set. So yeah, I think it's very important for us to focus on the person and the process.
Tamara, on that point, just to get to know you a little bit better, and for the APPF members to know you and those watching from the public, what has been, if you can think now, what has been the most difficult moment in your career? Is there something that comes to mind, or specific example or a season or so forth? What's been the most difficult moment in your career? For those of you that don't know, as we've now discussed, and you've all had sprinklings of what I've done and where I've been, but I was involved on the corporate side. I was involved on a tertiary level when I was within a clinic in a university setup. And then 7 years ago, we moved down to Cape Town, actually to Paarl. And that is then, already in Pretoria, I had a private practice, but then that move from Pretoria to Cape Town was quite a difficult season in my life. I started out just by doing some locums, and I hated it. I'm a terrible locum. Can I just say that for the record? I think that is why I'm such a successful independent audiologist, because I like my independence. And I don't like to be prescribed by a medical aid or anyone.
I've got very specific ways that I like to do things in my practice. So yeah, that was not so easy. And then the whole process of finding the right location, finding everything that I need to set up a private practice. And as all of you know, the first 3 years were very difficult. Being in a new place. In Pretoria, it was much easier because although I didn't start out there in private practice, I was in that community from the day that I graduated. So it was a much smoother transition for me than coming down to the Western Cape. And for all the young ones that have only started out with their own practice, I just want to say, hang in there. It will get better. It is tough to have a new business and to find your feet and to manage all of this that's now on your plate. I really think that is sometimes the difficult balance for us, to be good business owners, to be good clinicians, to be kind and good, nice human beings at the end of it all. That whole picture of giving a good service to your patients. And then we all still have a life when we close the door behind us. I've got 2 beautiful girls. Zara's turning 13 in December and Juliana's turning 10. And they also keep me very busy when I close the door here. I always joke and say sometimes being the Uber driver mom in the afternoons are more exhausting than being at the practice. But it's all about balance and finding that balance and giving my best when I'm here, but also giving my family my best when I'm at home.
Apart from cochlear implants, Tamara, what else are you passionate about in your practice and in your clinical work?
I'm in the very fortunate position here in Paarl, where my practice is, that I work very closely with an ENT surgeon. So the first thing that comes to mind after my cochlear implant work is my clinical diagnostic work. That is my favorite. You know, I love when someone presents with symptoms and I feel like Sherlock Holmes and trying to figure out what is in front of us and how does the pieces of this puzzle fit, and to then get to a final diagnosis and a possible solution for the patient. So that definitely keeps me on my toes. It's always a mixed bag of patients that come for clinical diagnostic testing, where with hearing aids, it can become monotonous. It's sometimes just, a sloping sensory neural hearing loss. But with diagnostic work, you sometimes have these interesting cases, a unilateral loss, a conductive loss, whatever the case may be that cross your path. So I'm very passionate about doing diagnostic work in the ENT setup. I also have a newborn hearing screening program. I've always been extremely passionate about newborn hearing screening. From a business perspective, it's not always that easy, but you also know, Cora, in private practice and in the South African setup, it's still actually alarming to realize how late we diagnose the babies with hearing loss. And newborn hearing screening is such a wonderful, pain-free, reliable method to be able to say whether a child can hear or not. So yeah, I feel passionate about that because we know the earlier we diagnose and intervene, the better the outcomes can be with a cochlear implant or with whatever the child might need in terms of hearing. And then I also love working with hearing aids. I do have a lot of hearing aid patients in the practice, and it's always so nice for me to find the right fit, if I can put it that way, for my patients. I strongly believe that I trial all my patients with at least 2 options of different brands, because I want patients to be part of the process of deciding on the technology that they would like. It is definitely more labor intensive, but I believe that my patients are happier because they are part of this process. So yeah, I definitely like that as well. And then I've got lots of tinnitus patients in the practice as well. As you know, that goes hand in hand. And I also like the treatment of those patients. So in this practice, it's a nice mixed bag. And the bone conduction implants, they're also nice. I always say they're straightforward. They are very rewarding because they're actually so easy to solve.
I just want to say to both of you that I'm so glad for audiologists like you that handle the little ones. Audiologists like me are so thankful for audiologists like you. No, because I realized the stress that goes with that, and even newborn screening. Just the word of thanks, because obviously it's necessary, and yeah, thank you for taking that stress amongst yourselves.
Well, I don't know about you, Tamara, but I love working with pediatrics. I really do. I love engaging with the family, but yes, it does become stressful, especially I've found with the intermediary phase between hearing aids and query cochlear implant. So that's for me it's a very important period of time where we don't want to extend it too long, but at the same time we don't want to rush it because we don't want parents to feel too rushed. So I find that that's quite a stressful time. And then while a child is trialing or using demo hearing aids, there's always a risk that they're going to break those hearing aids, which I've just had with a family of mine. And it's really difficult because what do they do and what do you do? You know, if the patient is a cochlear implant candidate, you know, they're not really going to be purchasing hearing aids. So I find that that's very stressful for parents. But Tamara, I wanted to ask you, do you have a group of patients or children that were implanted that have not gone into the traditional methodology of going to Carl de Toy and have ended up using sign language or a combination? And how have you dealt with that change in terms of South Africa and the educational limitations that we have with deaf signing children? And has that been sort of a contentious area for you that you've had to navigate with parents? Because I found that has been also quite it's a very stressful period of time for parents to choose and to make those decisions that are going to affect that child for the rest of their life. So just thought, has that been an area that has been quite a stressful area of focus of audiology for you, or is that also not something really that you've had to deal with? Because I know that in Cape Town there's such a lot of support compared to everywhere else in South Africa in terms of having Carl de Toy and Tygerberg right there and all the early intervention and all the auditory variable therapists, but it's not available, for example, here in KZN, not as richly. So I was just wondering if you've had those types of experiences as well.
I have to agree. I think those children that don't follow the trajectory of normal speech and language development and going to a mainstream school are definitely the most stressful and emotional cases in my practice. It's really not easy to deal with parents that have an expectation. All of us have expectations for our children. And if you goal set with these parents when they arrive and they're going with the cochlear implant route, of course, they have in their mind that they would like their child to develop spoken language and most possibly also go to a mainstream school. But unfortunately, that is not the case for all individuals. And even here in Cape Town, where we have lots of access to schools, it's still a challenge. I think it's important to start out by saying that we know that children with hearing loss, many of them have additional disabilities. As high as 40% of these children have additional disabilities. And that's what makes it so challenging. So many times we diagnose the hearing loss first, and that's what we address. But as time progresses, we then realize that there are other issues as well. And it's always an extremely difficult decision for parents to decide that they are now going the signing route. Once again, we are privileged that in Worcester, we've got a very good signing school where children then can attend school. But it's also sometimes difficult. I've got a little girl now that the parents have now made the decision that she should go on to a signing school, but they live far away. She'll have to board now in the residence at the school. And I mean, that's also such a big decision for parents. So on so many levels, it's got a huge impact. And unfortunately, in the South African context, I think our educational system is very broken for hearing impaired children because we almost have the two extremes. It's important to realize that Carl de Toy only goes to a grade 4 level as well. Hopefully they will expand that in future. But the idea is that children are ready for mainstream or they have to go a different route when they get to that point. But I've always said for the children that mainstream, it's awesome. And for the children that sign, there's options. But there is such a broad spectrum of patients that fall in the cracks where they haven't developed sufficient speech and language, or they are still behind with their speech and language skills, so they can't cope in the mainstream environment. So I have to say, educational placement of my patients is definitely one of the biggest headaches.
Tamara, I just want to ask something you mentioned earlier, that you, almost all of your patients that are hearing aid candidates, you trial them at least with 2 devices. Wow. So I want to know from you, is there some sort of sense that you have when you do that? Is it usually the second device, and you probably alternate? You obviously don't have to go into specifics, but you alternate which device you give first and which one second. Do you find that because of the adaptation period to hearing aids that they usually go for the one that they trialed second, or is it a mixed bag of outcomes?
Sarah, that is definitely a very good question. You know what? I have my own little scientific experiment going on the background, an Excel spreadsheet, because all the reps are dying to see that spreadsheet of mine, because exactly of that. Everyone's assumption is that most patients will then choose their second choice. And yes, I want to emphasize every single patient get a trial with 2 different devices. And the biggest reason for me is, I think it's important to realize, yes, from our side, there are many things that our settings need to be correct and we need to verify and all of that. But hearing aids do sound very different, because of the fact that everyone has their proprietary settings and algorithms that they use to amplify the sound with. And if you then bring in the new component of connectivity, apps look different, streaming works different. So that also influences patients' decisions. And I do alternate, but it's not, if I look at my stats of last year, because I actually went and took all that data of last year to see what was the most popular hearing aid in my practice and all of that, it's definitely not a thing of 100% of patients choose the second one. There is definitely a period of adaptation, but patients are sometimes very clever to say for themselves, you know, now with the second one, maybe XYZ didn't bother me that much because I've already had a week trial with a hearing aid. I only give them 1 week with each technology. So it's not such a long period that I think it can have such a massive effect if you've only worn hearing aids for a week. And as you know, most patients, if you already put them on target at the first or their verified targets, it is a bit too much. So in any case, for those first 2 weeks, they are sometimes slightly under, say at 90% of that. I try always to do a trial with 100%, but most patients say it's a bit too overwhelming. It's more important for me for them to listen to the sound quality, to take it for a test drive in noisy environments. And that is the most important thing that I see coming from my patients, is what hearing aids do in noise. We know that's our biggest challenge. We know that is what all companies are working towards, is to have better hearing in noise. And it is quite interesting how patients will specifically come back and say, with this hearing aid in noise, it was absolutely terrible, or I could hear, or whatever the case may be. So patients hear the difference. We are really at a point with technology where patients can hear the difference. I'm all about choice. And the best thing is when reps come to visit me, I always say, you can't be upset with me because I don't fit your hearing aid. My patient doesn't choose it. It's my patients that are deciding. It's not me. And I think from an ethical, moral standpoint, it makes me sleep at night, because I never feel that I'm making a choice for ulterior motive or for my own clinical audiological choice. Because it is interesting. I think all of us are biased and we do have a slight preference for one or the other. And it's sometimes on paper that we are impressed with a hearing aid. But it's always interesting then to see if this hearing aid is in the real world environment, what patients' feedback are. And there are some specific cases where I will make specific recommendations, clinical recommendations in terms of a hearing aid, where there's certain features where I feel, but I do need this to give a patient access. But for most patients, They are part of the process.
Well, it certainly sounds like you very much are one of those people that is offering the best standard of care for all of your patients, and not only offering them choice, Tamara, but really offering them such comprehensive services from the diagnosis and through to all of the options that are available to them. So we at APPF are very, very fortunate to have you a member, and also the public will be very, very fortunate to have you as part of I Am member, the Independent Audiologist Matrix, because you fall very perfectly within a special scope of audiology, not just independent private practice, but someone who is offering their patients a standard of care that is equivalent to any international benchmark. So thank you for all your passion for the industry and for your patients and for all of our patients, because it's against you that your patients will compare everyone else, should they decide that they ever need to see anyone else, or you decide that you want to retire, which probably won't happen anytime soon because you're only in your 20s. But I just wanted to say thank you very much for your passion as a human, for always wanting to do the right moral, ethical, professional thing, but as an audiologist, for offering your patients choice, for offering your patients the best that you possibly could. So thank you, because we can all take an absolute leaf out of your book. Thank you so much for your time and your input and your passion today. It really comes through. And please reach out if you have any mentoring opportunities that you would like, any younger audiologists in your area that are looking for assistance. I think that you would be a perfect type of person. You speak so well, you train so well, and you are just a wealth of knowledge. So thank you.
Cara, thank you so much for your kind words. I appreciate them. I'm humbled by them. And I really don't think I do anything special, or that I've got a secret sauce that I give to my patients. I think for all of us, this what is in our hearts. And if we give our clinical skills with compassion and from our hearts, all of us will have level of care that's excellent. I love to mentor. I've always said I never feel threatened by new audiologists coming into my area. I always embrace it. I've got a colleague in a neighboring town and another one also not far from me that phone often. I always say, you know what, I'm a WhatsApp away. You are welcome to ask your question, even if you have an audiogram that you feel unsure about, or you want some advice on amplification that you are choosing, whether it's a good choice. I love to mentor, because I believe that is what is going to give audiology a bright future, is that if we take hands and we all work together to get everyone's skills up, our profession is really going to become a beacon of light in terms of the service that we offer. So we should really stop blaming, pointing fingers, saying, you do this, you do that, you do it wrong. That's not our attitude. We are supposed to take hands and say, you know what, come and have a look. I'll show you how you do it. I see you did this wrong, but I'll teach you the right way. I've always said within our profession, it almost feels like there's a lot of bickering and a lot of comparison and a lot of he said, she said, and that's really not the way to move forward. In interest of all our hearing impaired patients, we as professionals should work together to get the level of care in South Africa to a better benchmark.
100%. I couldn't agree with you more. I could have said that myself. It was like the words were just coming out of your mouth that I was thinking. So thank you so much for all that you do, and thank you for your hour that is precious in your business during your day to give to us and to give to the public. And if anyone from the public is watching and has resonated with Tamara as a really high quality, passionate audiologist in the Paarl area, then you can go to www.independentaudiologists.co.za and find Tamara there as an I Am member. Thank you, Tamara.